This is the Optimal Wellness Podcast, helping you achieve optimal wellness naturally, with your host, Dr. Clifford Fetters of Health and Wellness of Carmel.
Welcome back to the Optimal Wellness Podcast. As always, I'm Cassidy Waters.
And I'm Clifford Fetters.
And today we have a lot to cover. We are talking about headaches and migraines. So let's talk about headaches first. What exactly is a headache? What does a typical headache look like? Are there different types of headaches?
Everyone has headaches. There's severe and mild. So there's different types of headaches. Tension headaches is the most common. You feel just generalized headache kind of all over, often in the temples. And then the worst one, the migraines. I don't know if not everyone's had migraines, but I used to have migraines. I never have migraines anymore because of holistic health. So a migraine is usually one-sided. You feel nauseated, sick to your stomach. Neurological symptoms, tingling. I would have aura where I'd see flashing lights. It's scary. You think you're having a stroke, and it can last for hours. It can be incapacitating.
Yeah.
So that's a big deal. Then sinus headaches, never want to miss a sinus headache. And then cluster headaches are recurrent headaches.
I've had headaches where I can just feel it on the top of my head. Like you mentioned, a sinus is probably through here.
Usually.
So is it just, are those all just headaches and then a migraine is just more severe?
Correct.
What causes just a common headache? You hear all the time, spouses say oh, I have a headache. And their spouse always says, have you had any water today?
Yeah, right.
And that's always the most common one, right?
Right. So we think of stress is the biggest thing, the biggest trigger. But how do you manage stress? By staying hydrated, by eating healthy, by getting your sleep. Probably most importantly, have a routine. When people have a routine, their brain is not stressed. Humans, and particularly as you get older, the more routine. There's something called sundowners. When older people at night, you change the routine or have them move to a new location, it can be a month for them to adjust.
Wow.
But even short term, young people, any change can be stressful.
A lot of people talk about hydration, like I said, the water part. So is that, if you're starting to develop a headache, right, and you don't want to take pain pills, things like that right away, that's always my first line of defense is I'm going to drink some water.
Right.
Should we pay attention to where it's at, or should we just hop right into some sort of supplementation?
Right. If it's an average tension headache, then actually progressive relaxation technique was what I learned. So your muscles are just tense. So number one, are you gritting your teeth? I used to do that all the time. I just train myself just to stop doing that. And number two, there's progressive relaxation technique. You can't tell your muscles to relax.
Right.
So you take your hand, you tighten it, relax it, then contract, extend, so you go through your whole body. And then when you do that, it's like your whole body's relaxed and your tension headache just melts away.
Wow.
And so again, stay hydrated. Again, think of what you ate. Do a retrospective food allergy panel, because food allergies trigger all types of headaches, even tension headaches.
Gotcha. And I think about too, whenever I get a headache, or you kind of think of, for women, we can be around our cycle, right? But also I think, how long have I stared at screens today? So I went from my tiny screen to my medium screen to my large screen. And I think that's a huge thing that people don't really think about is, again, we talk about in holistic medicine, you really have to pay attention to your body and what you're doing. And I tend to be okay, I haven't had a lot of water, or I've had too much caffeine, or I've been staring at my screen. So it's kind of just awareness too, right?
But a lot of times, not just even the screen, you're so intense. So just, again, you just have to train yourself. Okay, relax every muscle in your body and, just tell yourself, okay, chill. It's not, and then, people put stress on themselves. Okay, it's not the end of the world. I don't have to do everything this second. And just psychologically, if you can just get this kumbaya, even when you're doing hard work, if you can just let your mind do the work and let your body relax and kind of dissociate those two.
Yeah.
For me, that works really well.
Yeah, I was going to say, that's good to know, just knowing kind of.
And your posture and just make sure you relax. If you're like this and you're intense, it does it with your brain too.
Yeah. Okay, so then let's switch over to migraine. So is migraine something that, deep breathing, stress, easing your stress, or is it more, do we need supplementation to interact with that?
Right. Well, I had incapacitating migraines. So for me, it was food allergies.
Okay.
The big five: gluten, dairy, soy, eggs, and peanuts. When I stopped eating those five, it's that was 90% of it.
Oh, wow.
And the big thing people forget is heavy metals. Mm-hmm. If you do everything and you're still getting migraines, almost 100% of the time, it's heavy metals. Okay. So we see young people, even as 18, the average 18-year-old that I see probably has lead 5 times higher than what should be.
Oh my gosh.
And not from a routine blood test. You can't, if people go in, now you can order any test yourself, but it really has to be a provocation. You really need a IV or oral specific medications to just pour it out.
Okay. And we'll put that in the description, what type of lab tests and IVs that we suggest for that kind of treatment. So that's good to know. So when looking at, we talked a lot about just kind of de-stressing your life. When it comes to holistic versus traditional, when you're going to a traditional doctor, are they going to tell you something different than the holistic world or similar?
Yeah, I mean, the most important thing is that traditional doctor's going to make sure there's nothing else going on.
Okay.
Temporal arteritis is a more acute thing. So if you have pain over your temples, there's an artery there, and untreated, you can go blind in that eye. It's irreversible. Yeah. Everyone worries about brain tumors. So, sometimes they do imaging. So if it's just classic headaches, most of the time I don't do imaging, but if there's confusion or neurological symptoms, they'll do an MRI, but they'll do routine blood tests. I mean, do you have, and the sinus infection, sometimes it's only pain. And there's some, you said that, yes, the frontal, the ethmoid sinuses, but you have the sphenoid sinus back there. Okay. And you have no symptoms at all, just a headache that location, and you give them antibiotics and it's better.
Oh, wow.
That's the time you can do a CT scan to where it is, but you really want to do a CT scan. So empirically, sometimes we do use either traditional natural antibiotics or real antibiotics just to clear the sinus infection. Okay. But the main thing is rule out something else.
Okay.
Acute eye pain that's red, you worry about acute glaucoma. So that's, again, if you're just in your eye. So if you have headaches, worsening headaches, severe headaches, I mean, you should see a doctor, just rule out anything else.
Yeah, so it's basically you want to look at the headache, but also other symptoms that you're having.
Make sure nothing else is the root cause.
If you're hydrated and all those kinds of things, watching your
right, you did basic things you should do.
Yeah.
Make sure you clean up your diet. Processed foods. Process how many chemicals, how many 1,000 different chemicals are in processed foods, and chemicals can cause migraines. Sensitivity, you can get sensitivity. Now we have more and more advanced sensitivity testing, and just these toxic chemicals are severe initiative of allergies.
Yeah.
And allergies can trigger migraines.
That's good to know. And you can also do those kinds of tests here with us. Also, you can get your food sensitivity test. So going into supplementation, I know for me personally, magnesium has been a huge thing for me. Especially before I had kids, I would get up and lift in the morning and then I would have a terrible headache. And then, I think helping that at night, taking that, it had helped immensely.
The average American is magnesium deficient. Pretty much all multivitamins have some magnesium, but it's such a large substance that you really, most people should take magnesium. By far.
And then just looking, I think I would assume at your blood work, you can see if you're deficient in vitamin D or zinc and things like that. Those could also probably be leading to some sort of headache.
And as you know, our diet, no matter how organic you are, you're still not getting the micronutrients.
Yeah.
So, all our patients take a broad spectrum multivitamin. Vitamin D is critical, vitamin C. But B vitamins, definitely B deficiency causes headaches.
Okay.
That's a big deal too. Vitamin D also. And sometimes omega-3. Omega-3 really helps calm down the vascular system. Because, migraines, there's a spasm, then contraction. So obviously magnesium stops the muscle contraction, headache here, or the vascular spasm.
Yeah.
So that magnesium for sure.
Yeah. Well, and I've noticed too, in a lot of like energy drinks and things like that, or protein powders, like they will have, I've noticed with my caffeine that I drink in the morning, it has zinc, magnesium, things like that, because I'm imagine that's probably part of the problem is not just, I need my caffeine. It's, I need these minerals.
Exactly.
Okay, so we have a couple questions from our listeners that I think everybody would benefit from hearing. So the first one is, will alcohol or smoking make my migraines worse? I think you know that one.
Of course, right. Alcohol, hypoglycemia, sugar, any type of high sugar food will crash your blood sugar, and that can trigger a headache.
Yeah, I feel like the older I get, it's like every time I have a cookie, immediately I have a headache.
Yeah, and then obviously alcohol. Alcohol from 100, alcohol is a toxin.
Yeah.
Moderation for things are okay, but as a rule, alcohol is a toxin, and it's toxic to your brain.
Yeah.
That's the concern.
Yeah.
Yeah. Smoking, all the chemicals in smoking is hard on the brain. Those chemicals affect your entire body, but particularly the brain.
Are there medications or conditions in my home or work that may be causing my headaches?
Yeah, lighting, lighting for sure. We like soft lighting, and it's more expensive, but it's worth it.
Yeah.
The brightness is sunshine. If the sun's coming into your environment. Mold toxins. Mold toxins are terrible for the brain, and mold. 1/3 of every building in America has this, and you need to look into it. It's expensive, but it's not good for anyone.
Yeah. Well, and I was going to say, like, your filters, things like that, making sure you're changing them, because I can definitely notice when it's time, because my allergies are like off the charts. So,
and then new carpet, anything new that comes in. But it's a thing now. So you can buy, when we bought carpet, there was huge selections of that's chemical free.
Okay.
So your paint, pretty much everything you do when you remodel, you really should be considering that.
Yeah. And the last one, will exercise help? I think we know the answer.
Right. Because what's the best for me? What's the best stress reliever?
Yeah.
My nurses know if I go more than one day without exercise, I'm grumpy. They can tell you haven't exercised today.
Yeah.
I mean, really, exercise is probably, to me, the best stress reliever.
Yeah, I agree. And I think, like I mentioned with the magnesium, I think you want to make sure if you are exercising that you do refuel your body. Because then when you are running your body like that, and if you are methylated, like we've talked about, your body can really run low really quick. So you want to make sure you're keeping up with your vitamins and minerals and staying hydrated.
And also sleep. I don't know if we mentioned that, but sleep deprivation is horrible for people. I'm never the life of the party. If I get to bed by 11 p.m., I'm fine. Because I wake up, if you have normal rhythm and circadian rhythms at 6 o'clock in the morning, I wake up no matter what.
Yeah.
But that's the way it's supposed to be. My adrenals are kicking in. I'm ready to go. But if I go to bed at 1 in the morning, I will wake up at 6 and there's nothing I can do. And my brain, it's like I rarely drink, but it's literally like a hangover.
Oh, yeah.
So sleep deprivation, abnormal sleep. I know I love my people that work second and third trick. We need people doing that. But for longevity, it is bad for you. So if you're young, maybe a few years, but try not to do it your whole life. Some people are not nocturnal, and they actually have been shown that nocturnal people that really thrive at night, actually, that they should be doing that. There really are some people that do that, but the average person, it is really almost all cause morbidity and mortality is increased from doing that second, third shift.
Oh yeah, I believe it.
And all the nurses listening, well, sorry, but the good news is once you get seniority, so when you're young, you can do that as a doctor and a resident. We had no sleep for years.
So you see a lot of things today that market, especially pain pills, that market specifically for migraine. Right. Is that even a thing? Can that be done? Can you transition to something else?
Yeah, I mean, sure. For migraines, I mean, if you have migraines, since they're incapacitating, you should have them on you. Women should need them first. A man needs to have it every location that they are. They're generic now, so they're not expensive. Yeah. So Imitrex, everyone knows about that. But now Max Salt, and their little melt, you put it under your tongue. There used to be nasal sprays, because once you're sick to your stomach and throwing up, you can't take a pill. So it's come a long way. So absolutely for prophylaxis, because you know what? Sometimes you're not going to get your sleep. Or sometimes you're not going to eat healthy when you're traveling. So definitely you need to have that. Yeah.
Well, and I think it's funny because you hear people say like, oh, my sinuses are only relieved if I take an Excedrin migraine or something of that nature. So we were curious if that is like, if there's something different in those drugs than like your traditional pain medicine.
Just caffeine.
Okay.
Caffeine, I'm glad you brought that up. Caffeine withdrawal is huge. Yeah. Huge. And so one migraine expert, he was Brit, of course, and maybe they have more caffeine than we do, but he said that his research, more than 50% was caffeine withdrawal. Yeah. I can handle caffeine. So if I do caffeine in the morning and in the evening, I do better. But I can tell when I used to not drink coffee, but now we decided coffee is so healthy. Yeah. That I do have to watch it because I can tell if I just do a little caffeine, I'm okay. Yeah. And also, and the natural web. So curcumin is huge. Curcumin, turmeric is probably the best natural anti-inflammatory. There's something called BioLA that has white willow in it. So when Jesus Christ walked on the earth, I always wonder, what did they take, 1,000 years ago, or 1,000 years ago, and it was white willow. And that works really well naturally. Okay. Curcumin. So between those two, usually it works really well.
Okay. And again, we'll have all of these listed. And going along with that, this month of June, all month long, we're doing a BOGO. So buy one, get one, 30% off of all of our migraine and headache medications. And again, I'll have those listed for you guys. So you can head over to our website and get that discount. Is there anything else we want to add today?
Oh, I guess, for prophylaxis, for people with migraines, until you get this under control, I mean, the anticonvulsants and beta blockers. Okay. But, traditional, integrative doctors use that a lot. They're very safe. They've been used, for many, many decades. Okay. So there's definitely prophylactic medications to take, both for just tension headaches and for severe migraines.
Okay. It's great to me.
So Depakote and Topamax are the two most common ones, and that Inderal is probably the most common one. That's a beta blocker.
Okay.
And, they're all generic. They're not expensive, and they're very safe.
Okay, and those are treating migraines.
Right, preventing migraines. Yes, for tension Ace, I mean, that's on you. If you're getting tension Ace, you just need to work on your lifestyle. If you need to take, something like Migraine-X is something that's an herbal concoction that just relieves tension and prevents headaches. But really, you have to do whatever you can for your environment, and your lifestyle.
So on top of supplementation with the holistic treatment, are there any other therapies that you can do that can help with migraines,
Sure.
headaches?
So, I mean, meditation. Everyone should know how to meditate. Yoga. I mean, yoga. Just stretching and yoga is amazing for releasing tension and just breathing. I've been trained since I was, started medical school. They taught us that. But it's amazing how I've been watching my patients and see their shallow breathing. And there's adults that never heard of proper breathing. Yeah. And that makes a difference in just increasing your oxygen to your brain. Yeah. So proper breathing, I think there's so many different ways to learn about stress, but those are the top three.
Yeah. Yeah. And I've heard a lot about acupuncture. My family is a big acupuncture family.
Absolutely. Yeah. There's many amazing acupuncturists around here too.
Yeah.
It definitely works.
Yeah. All right. Anything else you want to add?
Yeah, it's your lifestyle. If you have headache, it's your body telling you something's going on. You're doing something right. If you can't figure out, find a doctor, a holistic doctor, either way. But headaches is one of the most common things a doctor will see. Yeah.
Well, thank you guys so much for listening. Tune in next month. We're going to be talking skin health. It's just in time for summer. So go ahead and like and subscribe if you want. We'll catch you next time on the Optimal Wellness Podcast.
Thank you for listening to the Optimal Wellness Podcast. Subscribe now to get monthly episodes to help you achieve your wellness goals. And if you'd like to learn how we can help, schedule an appointment at Health and Wellness of Carmel today. Just go to hwofc.com or call 317-663-7123.